My name is Lucy Bucklehide, and I'm a member of the charter class at OUWB School of Medicine.
I'm Christopher Yeager, a member of the charter class here at OUWB.
My name is Brandon Lujek, and I'm a member of the charter class here at OUWB School of Medicine. So being a member of the charter class was something I was looking forward to when I decided to go to Oakland. I think it's really neat to be a leader, especially not only of our class, but the school itself. You can kind of blaze your own path and create traditions that will be established here at Oakland for many years to come, and I think that was another reason I decided to come to Oakland, but also kind of the best point of being a member of the charter class.
I think that being part of the charter class has really brought our class together even more than I think it would if we weren't the charter class. Because we're all in this together and sort of starting this school, and not just with the students, but with the administrators and the faculty. And I think it really helped create more of a community.
I think on a broader perspective, being part of the charter class has really given us a unique relationship with Beaumont Hospital and the surrounding OU community as well. Everybody kind of looks to us as the people who are setting the tradition, setting the history, and it's really cool to be a part of that, and it's also very motivating for our class to do a lot more than a normal class would at a legacy medical school. Capstone at OUWB is a 4-year endeavor. It's part research, part class, where you're first trained on how to do a research study and on everything from doing a needs assessment to writing up an IRB, getting approval and all the processes related to that, and also to eventually turn your research into a publication. But you're also hooked up with a sponsor at Beaumont Hospital physician who will help you, who will help guide you through your entire research project. But you are the principal investigator for your project, and you are supposed to start and complete your project within the 4-year allotment.
My capstone project is basically about dogs, both service dogs and pet dogs, and how they might influence adolescents and young adults with Autism Spectrum Disorder. I did have this sort of high-reached goal in the beginning of working out my capstone project, where I was hoping to train dogs who needed homes to then benefit people who they would assist in some way. So basically, helping both dogs who need a home and then people who could benefit from their services.
So my capstone project is titled Penile Sensory Testing as a Surrogate of Cavernous Nerve Function in regards to erectile dysfunction. This is an important health issue to study because erectile dysfunction is a very common disease process amongst middle-aged and later-aged men, especially those who have to undergo a prostatectomy for prostate cancer, which is a very common form of cancer in this country and in the world. There's a lot of work being done in the urology and scientific community right now to try to pretty much boost erectile function in different methods other than using medication.
So my study is called Prevention of Throwing Injuries in Youth Baseball Players. It kind of ties in preventative medicine as well as kind of gets me out into the community which I lived in to try to help youth baseball players. And so the study is trying to show that with the implementation of certain prevention strategies in youth baseball players, we can kind of reduce the incidence of their throwing injuries at a young age. There's been an increased incidence of throwing injuries in these players at a young age that will correlate to more injuries as they get older and start to play more baseball. So I really wanted to study how we can try to prevent injuries before they happen. It's definitely more cost efficient, especially with the growing cost of healthcare now. So if we can prevent more injuries, we can definitely help our patients out better that way.